KVA 9 News.
The flu is rapidly spreading across the country. That is the word from the U.S. Centers for Disease Control and Prevention. And the rise in flu-related deaths also on the rise. Officials with the New Home Baptist Church in Pisgah, Alabama, announced the death of 14-year-old Noah Smothers Monday. Noah was a freshman at Ider High School, an active member of the youth church group, and described as a young, kind man. The 14-year-old was being treated at T.C. Thompson Children's Hospital. Funeral services were held this afternoon at Cornerstone Funeral Chapel. So far, 7.5 million people have gotten the flu. 81,000 have been hospitalized and about 3,100 have died. Our Wayne Herford spoke to a local doctor about the seriousness of the spread and what you can do about it.
Emily Favela brought her son Emilio to Internal Medicine and Pediatric Clinic in New Albany. She is concerned about the rising number of flu cases.
Okay, as a mom, it is concerning because you don't want your kids sick, during this holiday season. And as a mom, all sick. It's really scary.
Is that right?
Right.
She says that Emilio will get the flu shot.
It's necessary, especially with all the cases that there is. And there has been some deaths too, which is really scary as a mom.
A local doctor says that he is seeing evidence of the rising flu cases.
We're seeing lots of flu A and flu B this season. Obviously, RSV and even COVID is creeping back up. But most people are just having lots of aching, body chills, fever, just not feeling well. But flu A and flu B are pretty prevalent this time of year, but COVID and RSV are also what we're seeing.
There's even talk of a superbug that is going around. Dr. Scott says he doesn't know a lot about that, but he says no matter what the situation, the same rules apply when it comes to prevention.
Since we don't have a vaccine for the superbug, what we can do is what we know already works, which is basically hand washing and staying at home and staying away from those who might succumb to that illness, especially our elderly neighbors and family.
Dr. Scott says it's still not too late to take the flu vaccine, even if you haven't taken it this year.
Vaccines are still recommended, actually. Okay. So it takes 2 weeks for the vaccine to be effective once you've received it. So the flu season will run to the end of March, so it's still wise to go ahead and get the flu vaccine. Even if you've had the flu, the vaccine is still helpful for the other types of flu that you might not have contracted.
That sounds like good news for Emily Favela and her son Emilio.
That was Wayne Herford reporting. Dr. Scott says it never hurts to check with a local doctor if you're suffering from any of the flu symptoms.